Assalamu alaikum. My name is Dr. Rabia Sajjad. I am from Department of Anatomy, Sahara Medical College, Narwal. Today, the topic of my discussion is hip bone, general features. At the end of this lecture, you should be able to understand the formation of pelvic girdle. You should also be able to understand the main features and identify them of hip bones which are forming the pelvic girdle. We should also be able to do the side determination and the main anatomical position of the hip bone in pelvic girdle. Okay, in this diagram you can see that the inferior appendicular skeleton will have two components. One is the pelvic girdle, which is basically joining the trunk and the lower limbs, and it is formed by the two hip bones mainly. And then we have the free lower limbs below these, which are also joined to the pelvic girdle. Now, pelvic girdle here is formed, as you can see in the diagram, by two hip bones. The two hip bones are joined to each other anteriorly at pubic symphysis. Posteriorly, they are joined to sacrum through the sacroiliac joint, and then they are also connected to the vertebral column by this joint. Laterally on the outer surface, you can see that the femur, which is the bone of thigh, is joining the pelvic girdle on both sides and forming two hip joints. So the weight of the upper limbs and head and neck and the trunk region is transmitted to the pelvic girdle, and here then the weight is divided into two halves and distributed to each of the lower limb. The vertebral column is going to transfer the weight through the sacroiliac joint to the pelvic girdle, and the pelvic bones or the hip bones are going to transmit this weight through the hip joint to femur and then onwards to tibia and then the bones of feet, through which the weight will be transmitted towards the ground. This diagram is showing the hip bone of a 13-year-old child. We can see the epiphyseal cartilage which have not joined yet. So there is not complete synostosis or replacement of the joining cartilages by lines. Here we can identify three main parts of hip bone. The superior fan-shaped part is called ilium, and the antero-inferior part, which is shown here in purple, is called pubis. The postero-inferior part is called ischium. The three parts joined together at a cup-shaped structure called acetabulum. You can see the triradiate cartilage, which is showing the joining parts of the three bones, and the cartilage is present here at the point of fusion. This cartilage will be replaced in older age or after puberty by a triradiate line, and then in older adults this line is even not visible at all. But before the age of 13, some parts may join, like the lower part of pubis and ischium, as has shown fusion, where it is labeled as synostosis completed at age 9. Here you can see a cup-shaped cavity or a structure called acetabulum, which is present on the outer surface or lateral surface of hip bone. It is basically a structure present at the fusion point of the three parts of hip bone. You can see that upper 2/5 is formed, or superior 2/5 is formed by the ilium. The antero-inferior 1/5 part is formed by the pubis bone, while the postero-inferior 2/5 part is formed by the ischium. Now you can see that at anteroinferiorly the margin of acetabulum is interrupted and it shows a notch called acetabular notch. Just above the acetabular notch you can see the non-articular area of acetabulum, and this depressed area is known as acetabular fossa, and in living persons it is filled by fat. Also visible is a horseshoe shaped articular surface. You can see that it is lined by hyaline cartilage. The surface of the acetabulum is known as Leonid Surface, and Leonid Surface is going to be involved in the formation of hip joint. The head of the femur is going to be attached to this surface. The margin of acetabulum is going to give attachment to acetabular labrum, and
The first part we are going to discuss is ileum.
ilium is the superior expanded part of hip bone. It is basically forming at the superior 2/5 part of acetabulum, where it joins with the pubis and ischium. Here you can see the light brown colored part is ilium, while the red colored part is the pubis bone and the blue colored part is the ischium. Here you will see the outer surface or lateral view of ilium. You can see that the upper part of the ilium, which is a border-like portion, thick border-like portion called iliac crest. The lower end or lower part of the ilium is joined to the other two parts at the acetabulum. Then ilium has an anterior border, a posterior border, which is visible in this view. Medial border is not visible in this view, and only the outer or gluteal surface is visible in this view. If you can see the iliac crest, it is basically a convex uppermost free border of ilium. It starts from anterior superior iliac spine and ends at the posterior superior iliac spine. You can see that it is thick structure and it has outer lip which is visible in this part, an intermediate area which is the rough part, and an inner lip which is present on the medial aspect, which you'll see in the next diagram. Okay, 4 to 5 centimeter posterior to the anterior iliac spine, you can see on the outer lip there is an elevation, small elevation called a tubercle of iliac crest or iliac tubercle. This tubercle is an important landmark. You should remember it. Then you can see that the anterior superior iliac spine, if traced downward, it ends at anterior inferior iliac spine, which is another elevation anteriorly, and then this continues up to the acetabulum. The whole part is called the anterior border of ilium. Posterior superior iliac spine, if traced downward, we see the posterior inferior iliac spine, which is another elevation, not very prominent. And then below that we see that the posterior border of ilium is going to form a notch-like structure called greater sciatic notch. Then we can see the outer surface of ilium, which is basically called the gluteal surface, as the main muscles, three important muscles of the gluteal region are going to be attached to this surface. This gluteal surface is convex and it shows three lines which are going to divide this surface into four areas. Now you can see that the anterior gluteal line starts 3 to 4 centimeter behind the anterior superior iliac spine and just in front of the iliac tubercle, and it goes downwards and reaches at the apex of the greater sciatic notch. Then we can see the posterior gluteal line, which starts 4 to 5 centimeter in front of the posterior superior iliac spine and also ends at the posterior end of greater sciatic notch. Then we have the inferior gluteal line, which starts just below the anterior superior iliac spine and it ends at the greater sciatic notch. as well. Now, the important thing to recognize here is the important landmarks: anterior superior iliac spine, posterior superior iliac spine, the iliac tubercle on the iliac crest, and then we have to identify the three gluteal lines. We also have to identify on the posterior border an important structure called greater sat.
Now you can identify the inner or medial surface of ilium. You can see the inner lip of the iliac crest on this view. Now, one surface, the gluteal surface, was discussed in the previous diagram. In this diagram, on the medial view, we can see the two surfaces: the smooth anterior iliac fossa, the concave surface, and the sacropelvic surface, which is present posteriorly. These two surfaces are separated from each other by the medial border. The iliac fossa is present anteriorly and is concave, and it is going to form the false pelvis, which is basically the lowermost part of the abdominal cavity. And then it is also going to give insertion to an important muscle, which is discussed later. Be- Behind the medial border, we can see the sacropelvic surface, the upper part of which shows an elevation, a roughened area called iliac tuberosity, which is going to give attachments to the ligaments of sacroiliac joint. Then we can see below the tuberosity and a smooth area, ear-shaped area, which is the articular surface forming the sacroiliac joint, and this is called the auricular surface because of its ear-shaped structure. Below the auricular surface, the smooth part of the sacropelvic surface is the pelvic part, and it is also labeled here the body of ilium, and above the fan shaped part of ilium is also known as ala of ilium. The second part we are going to discuss is pubis. Anterior part of the hip bone is formed by pubis. Pubis has three parts: the body of pubis, the superior ramus, and inferior ramus. The superior ramus is going to join the other two parts at acetabulum, and the inferior ramus is going to join with the ramus of ischium. The body has a superior border, which is going to end at an elevation laterally. This elevation is called pubic tubercle, which is important as the inguinal ligament separating the abdominal wall, and the lower limb is attached on the pubic tubercle. The anterior border is also known as obturator crest, and the inner border, which is going to form the obturator foramen, can also be visible. We can see the superior surface of the body, which is continuous with the superior pubic ramus. We can also see the outer lateral surface of the body. On the outer surface, we had seen the superior surface and the lateral surface. Now, on this view, we can see the pelvic surface, which is the inner surface of the body, and then we can also see the medial surface, which is labeled as symphysial surface here, as the pubic symphysis is formed between the two pubic bones, and the symphysial surface is going to join with the other symphysial surface. In between lies a fibrocartilage disc. Now you can also see that superior ramus of pubis has same three borders like the body of pubis: superior border, inferior border, and anterior border was visible in the previous diagram. On the inferior border, we can see that there is a groove, obturator groove, and as the pubic bone is going to complete the obturator foramen, which is present between the pubic and ischium, the obturator foramen will be filled by obturator membrane, and the part of the groove will be left and converted into a foramen. So the obturator nerve and obturator vessels are going to pass through that foramen. Now you can see the inferior pubic ramus is a flat structure. You can see the superior border forming the obturator foramen. Inferior border is going to be continuous with the inferior border of the ramus of ischium, and it is called the conjoint or combined ischiopubic ramus. Part of hip bone is ischium.
The posterior-inferior part of the hip bone is formed by this blue part called ischium. Ischium is going to form two posterior-inferior 2/5 of the acetabulum. The part of the ischium just behind the acetabulum is known as body of ischium, and then there is the ramus of ischium, which is connected to the inferior ramus of pubis. The ischium is also going to complete the obturator foramen by its anterior border. The body of ischium shows anterior border, which is forming the obturator foramen, the posterior border, which is also forming the margin of an elevation called ischial tuberosity, and then the posterior border, if traced upward, shows a pointy elevation called ischial spine, and below the ischial spine the border has a lesser sciatic notch, and above the ischial spine it is going to complete the greater sciatic notch. Then we have the lateral border, which is separating the femoral surface present between the anterior border and lateral border, and then the dorsal surface, which is forming the ischial tuberosity, the large elevated roughened area. The pelvic surface of ischium is not visible on this aspect. We'll see in the next aspect. You can see the smooth pelvic surface of ischium between the anterior border and posterior border on this medial view. You can also see the ramus of ischium, which is forming the combined ischiopubic ramus by joining the inferior pubic ramus, and it has an upper border which is forming the obturator foramen, the lower border, and outer surface which was visible in the previous diagram, and the inner surface, which is the pelvic surface here, forming the true pelvis. Side determination of hip bone can easily be done by keeping the acetabulum, the cup-shaped structure, on the outer or lateral surface. Then we can keep the pubic bone or pubis anteriorly, and then we can keep the ischium by keeping the ischial tuberosity posteriorly, and ischial spine will be very prominent posteriorly. And this way we can do the side determination of hip bone. In this diagram, the hip bone is of right side. The anatomical position of hip bone can be determined by keeping the anterior superior iliac spine and the pubic tubercle in the same coronal plane, keeping the acetabulum on the outer or lateral aspect, and then we can keep it in the anatomical position. Now, the general features, side determination, and anatomical position of the hip bone have been discussed in this lecture, and the attachments will be discussed in the next lecture along with the clinical features. Thank you.